Welcome to Nursing Edge Unscripted Saga, where we use stories to connect the past to the present and then our future as we reimagine our teaching and learning. As we celebrate the NLN Year of the Nurse Educator, we pay tribute to extraordinary nurses who have made significant contributions to nursing education. We dive into the stories of nurse educators who recognized a need, challenged traditional customs, and influenced transformative change. Over the past few months, we've highlighted the significant contributions of Doctors M. Beavis, Nancy Diekelman, and Chris Tanner, all of whom were instrumental in the National League for Nursing's educational reform effort, also referred to as the Curriculum Revolution. Through their groundbreaking work, these innovators challenged the long-standing content-loaded traditional model of nursing education and instead created new ideas and pedagogies which leveraged the individuality of the nursing profession. This month, we celebrate the contributions of another prominent leader of the curriculum revolution, Dr. Peggy Chinn, Professor Emerita of Nursing at the University of Connecticut. Dr. Chinn is probably best known for the creation of a feminist pedagogy in nursing education, which seeks to highlight the power imbalances ingrained within our educational system and empower those involved. Historically, institutions of higher learning have essentially been patriarchal in nature, arranged in a power over hierarchy, which diminishes the human experience and is rarely questioned. This power imbalance can occur in almost all areas of the education system, impacting the individuals involved. Dr. Chinn asked nurse educators to consider the student. She emphasized that in a traditional model of education, the student is prescribed an appropriate path to knowledge, which is dictated to them by those in power and with which the student has very little opportunity for input, if any. Next, like her curriculum revolution colleagues, she asked nurse educators to rethink the student-teacher relationship. Again, in a traditional model of education, the teacher is the one who maintains control by determining what knowledge is important and which individuals possess that knowledge. They accomplish this through tasks such as defining objectives, giving exams, and assigning grades. This can result in the student feeling helpless and powerless, which can ultimately reduce their overall motivation and diminish their learning experience. So by questioning these long-held educational traditions and creating a feminist pedagogy, Dr. Chinn advocated that nursing education reject existing power imbalances and instead adopt a less hierarchical structure, which allowed for personal empowerment. Given the realities of nursing education at the time, this was a radical idea. In her words, quote, "Nursing education needs feminist pedagogies now more than ever before, pedagogies that value diversity, promote more inclusive sharing and interaction, and model cooperative, not competitive, ways of working together. Feminist pedagogies are consistent with nursing values. Using these approaches, we teach and model ways of communicating, interacting, and working together that nurture each person's highest potential, high-level wellness, and harmony within their communities," end quote. Dr. Chinn advocated and promoted a caring, compassionate form of nursing education where we empower one another through our interactions. Along with her colleague, Charlene Wheeler, she published her new ideas in 1984 in the classic book entitled Peace and Power, a Handbook of Feminist Process. Since then, new editions of this book have been published, adapting to a changing world and educational landscape. Yet the core concepts of power imbalances and personal empowerment remain unaltered. In part 2 of this series, we will further explore Dr. Chinn's visionary model and the methods associated with the feminist pedagogy, including how exactly they can be implemented within nursing education. And so the saga continues. And may our saga continue as we bring to a close this episode of Nursing Edge Unscripted Saga. Thank you for joining us. And remember, good teaching doesn't just happen. Find your fit, push the boundaries, and celebrate the ahas.